Welcome back, J family. As you can see, we have a new little addition to the family. This is Mr. Elijah. Hold on, what are you doing? What you doing? He's attached to his passy. This is baby Elijah. He was born November 6, 2020 at 10:51 a.m. His stats were 6 pounds, 8 ounces, and 20 inches long. Now, I'm going to finish updating you. I won't say finish because we might not get to all of it, but I'm going to update you on what happened after he was born. So, after they took him away from me to go get his stats and everything, I am shaking uncontrollably. I can't control it. Like, you can see me shaking from across the room. And I'm so cold. And I didn't feel good. It's something, I knew something was wrong. And David's over there with me. And I'm asking him, please go stay with him. Please go stay with Elijah. And he's like, he's okay. I can see him. He was right in the middle of me and Elijah. And I felt bad because it felt like he didn't know where to go. So he's standing there and I look at my doctors and my doctors are panicking, and all I see is that something isn't right with my vitals. They're still trying to get my vitals up. They're still really, really low. And they're having a hard time delivering my placenta. Now, if you know anything about babies, and maybe you don't, but that's okay. The placenta is, you have the baby, and then you have the umbilical cord that is attached to their belly button. And on the other end of the umbilical cord is the placenta. The placenta was not coming out as we tried to deliver it. It was still attached. And I have history of this, and it is called placenta accreta. So what they had to do is go up inside of me and try to break it loose from my uterus. So as they do that, she's telling me to push, and finally the placenta comes out. The placenta does not look normal whatsoever. A normal placenta, as the best I could describe it, looks like a roast, a pot roast. Mine literally looked flat, like a balloon, like someone literally opened a balloon and let all the helium out, and it was just flat. The umbilical cord was attached on the side and not in the center where it should be. That was one giveaway. Something was wrong with it. Another giveaway was it had grayish, whitish spots on it, and that's not supposed to be there. So the doctor's talking to me saying we're going to send it off to get, oh, you want your passy? No. Saying they're going to send it off to get tests done and figure out what's going on with it. So at this point, she puts pads on me, and, you know, they're trying to get my vitals up. They're still not coming up. So I won't say his name. My doctor comes in at this point and is trying to figure out what's going on himself. So they take my pad off and see that it needs to be changed. Now keep in mind, they just put this pad on me. Yes, I did just have a baby, but the pad shouldn't have needed to be changed that quickly. So they put another pad on me and they throw that pad away. So while he's in there, they see that that pad needs to be changed. And they're trying to figure out, wait a minute, we just put this pad on her. What's going on? So they look, and I am hemorrhaging. I'm constantly bleeding. So he tells them, pull out anything that had blood on it from that trash can and weigh it. We need to keep up with how much blood she's losing. So everything they're getting, they're weighing and writing it down, and then they're setting it to the side. They worked on me for a while at this point, trying to get the blood to stop. And the stuff that they're using hurt. It hurt. Even though I had the epidural, like I said in my last video, it didn't really work. Not down there, because I felt everything. So after they get all that done, I'm still bleeding. He goes with his hand and his whole arm and reaches up inside of my uterus and starts pulling out these huge, and I mean huge, clots from inside of me. And he's just doing it, and he's pushing on my stomach, and he's apologizing, saying, I'm sorry, I know it hurts, but I have to do this. And I am literally sitting there screaming, and I'm just saying, it's okay, I understand. And he is pushing down on my stomach, and it hurts so bad. So finally he gets all the clots out, and I'm still bleeding, but not as bad. So they finally got it slowed down, and I remember them saying I lost between 1,100 to almost 1,200 cc's of blood. And that's a lot. So at this point, I'm shaking, I'm cold, I'm pale, I don't look right. They're bringing in blankets left and right, heating them up, putting them on me, trying to get my temperature to go up. And they're waiting to see if I need a transfusion. And they said they would rather not do a transfusion because they like to see if your body will replace the blood on its own before giving you blood if you don't need it. So I stay in the delivery room for a good, I had him at 10:51, and I didn't leave that room until probably almost 3. So I was in there for a good 4 or 5 hours waiting to see how my body handled everything. My vitals are still extremely low. They're not where they need to be. But my bleeding slowed down enough to where I could be transferred to the postpartum room. So I'm sitting in there, and they're trying to figure out if I can eat, and they bring me some food. I took one bite and I was done. I didn't want anything. So they're saying, okay, we'll just lay down and relax, and when it's time, we'll take you to your room. So at this point, the best way to describe how I looked at this point was David said I looked like E.T. I had blankets all over me, over my head. The only thing you could see was my face. And I ended up falling asleep. And when I woke up around 3, that's when she come in there and told us that we could go to postpartum. Which I was really upset at this point because I loved my nurse and she took such good care of me. And I felt safe with her, and I didn't know how the other nurses were going to be. But once we got to our postpartum room, we met our nurse, and she was nice. I went through 3 different nurses in the postpartum area because we were in postpartum for 2 days. Once we got in the bed and met our nurse for that day, they're in there pressing on my stomach, checking my bleeding, and it hurt so bad when they pressed on my stomach that I would cry every time they did it. Baby Elijah was perfect. You know, he was healthy. He stayed in the room with us. It was great. But all the issues had to do with me. Every time they checked my blood pressure, their machines would go off because it's so low. They're constantly giving me pain medicine anytime I ask for it. They're constantly giving me fluids to try and get my blood to come back up from all the blood I lost. I'm not eating much. I can't even walk without help. Anytime I got up, I needed David or a nurse. David helped hand me Elijah so I didn't have to get up and get him. If it wasn't for David and the nurses, I would have been really messed up because there's no way I could get out of bed to get baby Elijah. I couldn't stand. I couldn't walk. I couldn't do anything. And so I had him on Friday. Friday was okay. Saturday was a whole different story. The nurse that we had, I wasn't crazy about her, but she's one of those, she's older, she knows what she's doing. She kind of rough handles the baby, and she had a mouth on her, but it's okay. I understand. At this point, I was just ready to go home. She comes in there, she's pressing on my stomach, and she's checking my vitals. Why are your vitals so low? And at this point, I'm tired of having to explain to everybody what took place. I literally had to explain my story to every single person that come in the room. She's trying to get me to do this and do that. Okay, lady, I'm in pain. I can't walk by myself. So Saturday, I relied mostly on David for everything because we didn't like her. And I'm sorry to say that, but when I'm in that much pain, I don't want to have somebody that's rude and disrespectful around me. The best thing for you to do is just come in here, do your job, and leave. So David took care of me and took care of baby Elijah the best he could. And Saturday was okay, other than my levels still being low. They came up a good bit, but they were still really low. So Sunday, the doctor come in there and he said that he realizes the reason we went through what we went through with the hemorrhaging was because the placenta accreta. The placenta was attached, which caused some problems with the uterus, which caused the hemorrhaging. And he said he believes that, I would be okay. I was okay enough to go home. I wasn't in too bad a shape to stay at the hospital, but I had to take it easy. I couldn't do a lot of things on my own. He said it's just going to be a long healing process. So before I went home Sunday, I asked them, could I go ahead and get fixed, or could we schedule it to come in and get fixed? And he said, like we discussed in the doctor's office before, which we did, I couldn't get fixed right away after having Elijah because he was afraid I would flatline on the table. And when he said that at the doctor's appointments, I was like, oh, I don't expect that to happen. I'm fine. But after the delivery, I can understand why he didn't want me in surgery, because he would have lost me. And that's what he said. He said, like I said before, you might flatline, and with your delivery, that would have happened. I was like, okay, that's fine. We'll wait the 6 weeks, and after the 6 weeks, we'll schedule the surgery to tie my tubes. So my nurse comes in and she checks my vitals. My heart rate jumped up to right at 160. And she's like, are you upset? Are you nervous? Anything like that? I said, no, I'm just laying here. I'm fine. She's like, something's not right. And she checks it again and the machine is going off. And I have my mom on the phone and she's like, what's going on? And I told her, and next thing we know, another nurse comes in and she checks it and she just walks out the room. So they said that they think it was just, probably me sitting up or something. They don't know. So they sent me home at around probably between 12 and 1 on that Sunday. Look, ain't he sweet? Isn't he so sweet? Say hey. Say hey to the J family. He's sleepy. He has already gained. When he left the hospital, he lost I think he lost 4 ounces because he went home weighing 6 pounds 4 ounces. And when we went to the doctor, he went to the doctor on Monday or Tuesday after we went home, and they wanted him back 2 weeks later. So the 2 weeks after that, we took him and he was back up to 613 or 614. And I believe when we go to the doctor on the 11th of January, he's probably going to have gained a good probably a good pound, because he is a chunk. He was not this big when he was born. And I have another update for y'all. Things, probably about 2 weeks after he was, I wouldn't even say 2 weeks. Probably, no, it wasn't even a week. So 5 days after he was born, things took a turn. I will post that video in a few days, so come back for that update, and I will see y'all then. Bye.